Hi, I'm Mandy Nadeau, and this is my first time making a video blog for my WordPress site. And I usually talk about mental health, and I know I haven't posted anything probably since, well, I started my blog, which was back in the spring. I really don't like being on camera, but I figured, you know what, I'm going to do this anyway. I'm terrible at this. This is my cat Yoda. Let's say hi to Yoda. Hi, say hi. It's Yoda. So there'll be a lot of feline interruptus in this, but I just wanted to do this to kind of update from where I started to where I am now. Over the summer, I cycled off of my antidepressants, which were MAOI antidepressants, and I did it with doctor supervision. It wasn't alone. It was my doctor and I decided. This was before I had a psychiatrist, but we decided that after 9 years, with not much success in the last few years, they were wonderful in the beginning, that it was time to go off of them. So that's what I did, cycled slowly off of them through the summer instead of doing it in the winter, which would have been a lot worse. So I had a pretty hard summer going off the medication. It was hard to cycle off of something I'd been on for that long. I finally cycled down off of them about the end of August, beginning of September. I was off of them and got to seeing a psychiatrist again, and he put me on a new medication, Cipralex, which other family members have had success with. So it was kind of the easy choice. And unfortunately, there's not a lot of room for dosage, levels. It basically goes up to 20 milligrams from what I've been told. And I'm on the 20 milligrams, and I haven't been doing that well. We've tried adding a couple different medications to augment it. Oh, we have a Yoda moving, sorry. And unfortunately, the first one we tried was amitriptyline, and that just sent me into the worst brain fog and darkness I've been in the first week I was on it. So I said, no, I can't do this. And that was right before Christmas. So I took myself off of that. Now I'm on Abilify. At first, such a small dose, no real problems, but I noticed an uptick in my anxiety. And then when I went up to the next dose of that, my anxiety's become worse. And I'm having it's invaded my dreams. I wake up every morning, I'm in sweats, I'm not sleeping as much. My anxiety is just terrible. So I see my psychiatrist the end of this week, and I'm going to ask him to discontinue this stuff because, I mean, it's becoming a crippling anxiety problem, which my anxiety's been difficult through most of my adult life, but not like this. And I feel like I'm vibrating all the time. It's kind of scary. So, and my breathing, it's like my breathing is just, I'm constantly taking deep breaths all the time to try to fight it. So, hopefully we can remedy that, and possibly even talk about maybe changing the Cipralex to something I took before, Cymbalta, because it helps with pain. I wasn't on Cymbalta that long because I had an interaction with the medication I was taking at that time. Wellbutrin had a psychotic break on that combination. So maybe we can just try just the Cymbalta, and maybe it'll help with my depression and my pain. So that's that. Otherwise, it's really hard to talk about this stuff, but I think it's important to be open about it. A lot of people probably wonder, why are you still doing this? I've been on so many medications. And my depression doesn't seem to take to treatment. There's a lot of things that just don't work. I won't do ECT. I've seen people come in and out of ECT, and that scares the hell out of me. So to me, that's just not an option. I don't trust it. So that's one route I don't want to go down. But I have been looking into ketamine infusion therapy, and a lot of people think, oh, it's just, more drugs, just going to get high. It's a, it's a street drug. It's a sedative. It's what is it? Oh, it's an anesthetic medication. But there is a clinic in Mississauga, and the clinical trials were quite promising for people with treatment-resistant depression. I don't have a professional opinion on whether mine is treatment resistant, but the history of my treatment does show that I don't respond to a lot. And I'm going to ask my doctor to refer me to the clinic to get an assessment, which is covered by OHIP, but the treatment itself is not. And that's, I think, if I am approved as a good candidate for ketamine, the first session of, I think it's 4 infusions within 2 weeks, is $3,000. And there's no way I can afford that, but I want to know if I'm a good candidate, so I'm going to at least push to get the referral for the assessment to find out, because I don't want to be in the dark, and I'll go from there. So that's my update. And I appreciate you sitting through this. I know it's a little awkward. I'm not having the best day, but I'm here, and I'm glad you are all here too. And we can keep fighting. We can do this. And some days it's so much harder than others. And I just needed to do this today because I'm having a really hard time. And I know that I can just keep putting one foot in front of the other. And if I reach out, people will reach out back. I'm still figuring out this WordPress thing, so I know people have left comments and I haven't been able to get back to you. Thank you for them, and I apologize for not responding because I'm still a little illiterate to this blog thing. So I'm going to sign off here, and hopefully I'll do this again, and maybe next time you'll meet another one of my cats. Okay, so everybody, remember, you are sick, not weak, and I thank you for, thank Michael Landsberg for bringing that movement to the forefront. It's really helped me. And make sure you, check in on yourselves, okay? Take care.